Welcome everyone to the C.A.R.E Global Leadership Series in the C.A.R.E Global Studios, where we know C.A.R.E means the collaboration, the acceleration, the revelation, and the elevation. Today I am so excited, super excited to have joining us the CEO of AYG Insurance and Financial Services, the beautiful Miss Andrea Millsap-Bolden, all the way from Las Vegas, or she could be in Brazil right now, but the company is headquartered in Las Vegas. And I'm just so thankful, Andrea, for you taking time out of your extremely busy schedule to talk to the people, because I know what you have to say, the people are going to want to listen. So we're going to get right into this. I met you a few months ago through a mutual friend that we both hold in high esteem, and he told me about what you're doing, and I thought he was crazy until I actually sat in on a presentation and I heard what you guys are doing. Not only are you helping families, which right now with the climate of our society, you're needed more than ever, but the thing that really attracted me as a small business owner and entrepreneur is what you are doing for not only small businesses, but businesses across the board, whether it's government, private, nonprofit, education, hospital. You guys are doing something very unique and very special that I know that we need to get this message out there in a broad way. So I want to hear a little bit from you, Andrea, and just tell us, first of all, what inspires you to help people, because that's what you're doing.
Yeah, absolutely. Well, first, I just want to say thank you for, inviting us, myself and my partners here today, just to be able to talk a little bit about AYG and what we do and who we are. And I think that's, we should probably start there. That's probably a very important piece to kind of connect the dots for everyone. So AYG Insurance and Financial Services stands for Accept Your Greatness. And we believe that in our mission, empowering generations through financial freedom is what it's all about. And at AYG, our mission is to empower those individuals and those families to be able to achieve this lasting financial well-being. And the only way to do that is through the strategic elimination of debt and the application that we use of time-tested, wealth building principles and the delivery of our cutting edge insurance and financial solutions that we have. So in order to create a legacy, right, we have to be committed to forging that prosperity that transcends different generations, right? It can't just be you, Troy, right? And it can't just be me. It has to be able to affect multiple generations. And so that's what we're doing, because we know that there are so many businesses that need help, but there are also families and individuals that are either underinsured or they're not insured at all. And so we started AYG Insurance and Financial Services because we did accept our greatness, and we do want to help others be empowered to achieve greatness and accept greatness for themselves, whatever that may be and whatever that looks like, right? Because everybody's vision is different. But for us specifically, when we got started, there are lots of personal reasons why we were so driven to do this. Everybody knows someone that has passed away that's directly impacted your family, or you yourself personally. And we also know if you yourself don't have an ailment, someone maybe that's close to you or within 6 degrees of separation that has been impacted by something that has affected their health, right? So for me personally, I've been in sales and marketing for over 20 years, and I've seen a lot of different things, and I've been a part of different industries, but I spent the majority of my time in the health space. And I worked at Pfizer Pharmaceuticals for almost 10 years. And I was on the other side of insurance, right? Which was, providing information and knowledge on medication to physicians. I served all of Nevada and some other areas as well, but I worked heavily in some of the underprivileged, right, socioeconomic, neighborhoods that were impacted by the lack of insurance, right? And so it's very, very hard to have to go in and day out and see these offices filled to the brim, right? With typically, minorities, right, that do not have accessibility to good health coverage, right, for whatever that reason may be. And some of it is just also just the lack of knowledge to even know that it's there. So that's the first thing. The second part of it is that me, myself personally, right, we've all lost someone. I lost my dad to prostate cancer. My mom had breast cancer. Thank God she's still here. Me, myself personally, I've had breast cancer myself. I've, had cervical cancer. I have lupus, vasculitis, Sjogren's. I had open heart reconstructive surgery in 2019, right, from a birth defect that no one ever found, by the way, right? So all of these things help me to understand, along with my other partners who also have their own ailments and things that they've had to overcome, that there really is like a lack of information. And it's not because maybe someone's hiding it from us. We just don't know, right? You just don't know what you don't know. And so that is our main goal is, yes, we want to make insurance accessible, right, to everyone, especially underserved communities. But we also want to make the education of how to utilize your health insurance and also the importance of putting good life insurance in place, right? One of the things that my dad said to me, which is, it sounds crazy when you say it out loud, but, he was from Arkansas and he's born in like 1940. And he used to say, whenever we would talk about life insurance, he'd say, I'm not going to go spend all my money every month for my paycheck to make you guys millionaires when I die. Right. So he had like a $10,000 life insurance policy, which seemed like a significant amount when he initially started working in his 20s. But in 2009 and 2008, you can't really bury anybody for $10,000, right? And then what happens? Well, some of the policies that he thought he had in place when he passed away for my mom, who he'd been married to for 40 years, they just weren't there, right? She worked for the state, so then she can get a Social Security. These are things he just never knew. He just didn't even know that was going to happen, right? And so that's part of what we're talking about when we're talking about education. I had a little breast cancer situation. Didn't even know that I could get a policy that I could just cash out simply because I had an occurrence of it. But somebody that I worked with had the same situation as me. And then she came and asked me, how do I file my policy, to get this cash allotment lump sum because I have breast cancer? I'm like, I have no idea. She's like, you didn't do that? No, I didn't know. Right. And so when you think about the ailments that we have in our communities specifically, right? Diabetes, heart attack, cancer, and stroke. Everybody should have a policy for that. Everybody. Because when you go to the doctor and you use your health insurance card, your health insurance is covering that visit, right? You might have it out of pocket. It might cover some of your hospital days and some of your treatment. But you know what it doesn't cover? It doesn't cover you being out of work. And it doesn't cover your mortgage. It doesn't cover your light bill. You can't go to Target and swipe your health benefit card and say, I'm out of work right now. These are the things that it does not cover. And those are why those policies are so important. So if everyone just takes a moment and really thinks about themselves and their own 6 degree of separation, right? How you've personally been impacted by any one of these things, even someone passing away, and you have to sit down with your family or friends to discuss that they didn't have a life insurance policy or if they didn't have enough life insurance, and how are we going to bury them? I can't tell you how many of those conversations I've been a part of for every single one, basically, of my family members, right?
Yeah.
And then now we have to, I don't want to say bear the burden, but we do. You have to bear the burden of making sure that your loved one's properly buried. So that is why we are so passionate about what we're doing, because we don't want to go to another fish fry and we don't want to do another fundraiser and another GoFundMe and all these things. I get it. Sometimes it's needed and it's required because individuals just don't have the means or the resources. But think about this. You spend at least $25 a week on food, like eating out with your friends, or you bought a bag, or you have a subscription to Hulu and Netflix and all these other things. That's your payment for your life insurance policy. You don't have to go and get a $200,000 life insurance policy and spend $500 a month on it. You could get a life insurance policy for $10. So you have to just decide in order of importance, right? What's important for you. And sometimes what we say is important and our actions don't always align. And I think some of it just has to do with the fact that we just don't know what we don't know, right?
I mean, Andrea, you just hit on so many valuable pieces of information, but I want to point out the reason, right? One of my questions I was going to ask you is like, why are you inspired to help others, and what makes AYG have that emotional tie to helping people, right? Because a lot of companies out here, they walk that walk, but they're not talking that talk. But the thing that attracted me to you guys is that you are actually walking and talking that talk. But with so many relatable ailments that you have gone through, it's easy for you to put yourself in someone else's position because you've been there, right?
Absolutely.
And so have many of the partners. So the emotional tie is there. You're helping so many women out there, and I wish she was here with us. But Portia Kewington, am I saying the last name right?
Yeah, it's Kewington.
Okay, Portia Kewington, another phenomenal leader, co-founder of this company. You guys are setting an example for young women and young women of color that I really love, because I have a young cousin up in the Bronx, New York, who was attacked over Thanksgiving and literally lit on fire by another young woman, right? Unbelievable. So we need more positive examples of real women, right? I mean, you guys are some of the realest people I know. And when I tell you this, audience, Andrea is funny as you wouldn't believe, but she's also an astute businesswoman. You could be both.
You absolutely
right? You
can.
can be both.
100%.
Don't change who God made you just because you're trying to do this business. You don't have to change. You could be your loving, just caring self. But what you guys are educating the public on, the affordability, because you said it, you don't have to buy a big policy.
No.
You can spend $10, not even movie money, and cover yourself, because at the end of the day, it's not about us. She said it. It's not about me. It's not about her. It's about our loved ones, our friends, our coworkers, our communities that rely on a lot of us. Like Andrea, I'm very busy, community activated into this community like you wouldn't believe, into the world. So we're busy, and we want to just provide people with the information. But we're going to close in a second, Andrea. I want you to speak a little bit about what you are doing for businesses with your tax program.
Absolutely. Absolutely. Yeah. So, again, our goal and our mission is to be able to help individuals and families, right? But think about this. What are individuals and families a part of? They're a part of businesses, right? So whether you work at a business or you own a business, you make up that body of individuals and families. Mm-hmm. And so for everyone who goes to work, that is typically or traditionally, right, where benefits start, right? Obviously, there's a group that don't fall into this category, and that's fine. But for a large percentage, I would say 80%, 90% of the population, you're getting your benefits from work, right? Mm-hmm. And so because of that, what the program does, and it's not a program that we created, right? So we do have AYG Wellness, right? It's our AYG Wellness program. but we did not create or invent the tax codes. We do not own samur and all of these things because it's a government program, right? And by government program, I mean it's a tax code. And why is it in place? Well, it's in place because the government spends, and you can look it up, $4.5 trillion in health medical expenditures, whether that's from Medicare, Medicaid, the hospitals, private care, or other. What that means is there's this amount of money that the government has to cover, right? That they have to cover because people are either underinsured or they don't have insurance. And so that is money that they have to absorb. That's why programs like this exist. So what is the program? It's the self-insured medical reimbursement program, and it allows business owners to provide at no net cost to them better benefits, better voluntary benefits, which is what we're talking about, right? It allows the business owner to then receive about a 30% reduction in their workers' compensation, as well as their FICA tax savings. So most of those workers' compensation claims happen on Monday morning, right? They happen on Monday morning. And what this program helps to do is helps to kind of mitigate some of those claims. Why do they happen on Monday morning? They happen on Monday because over the weekend, not intentionally, someone got hurt, they didn't feel well, they got sick, and they can't afford to not go to work on Monday, right? So they have to go to work. So whether that's you have a cold, you don't feel well, you keep driving your body hard, you get hurt at work, right? Or you do have a serious ailment, but you have to do treatments and go to work at the same time, right? Because you can't use your health card at Target. So what this does is it allows the employees pre-taxed to then be able to get these additional benefits, right? It allows them to get a hospital indemnity plan. It allows them to get a critical illness plan. It allows them to get coverage, right? Everybody knows somebody who's had a baby, right? Did you know that your health insurance actually will pay you for that because it's considered an ailment? So you can get a lump sum for having a baby. But nobody knows that. So instead, you're going to work and you're working right up until the last minute until you just can't work anymore, until it's time for you to have your baby. And then you can't exhaust all of your maternity leave because you can't afford it. But you could if you had a policy, right? So these are the things that we are trying to educate on and then also make sure that the business owners have in place. So now what happens as a business owner? You have a business and you're responsible, right, for providing health care insurance and coverage to your employees. What happens is, and it's not intentional, right? The employers are responsible for paying for 50% of that. They can't afford that, especially if you're a small to medium-sized business. Trust me, I know. So what do? To be in compliance, you go and you get a larger plan that's probably pretty expensive, and then most of your employees don't opt in for the coverage. But you are off the hook because you can say, well, I did offer it and nobody wanted it. You see? So what this allows you to do is it allows you to provide more benefits at no net cost. And employers are saving roughly about $630 per employee annually. So that is a significant savings. So for these larger corporations, it's excellent because, yeah, they're going to save millions of dollars, 13, 14, $15 million, right? Just 630 times however many employees you have. But think about how this impacts the smaller to medium-sized businesses, right? That make up that middle class, right? Like us. What that means for someone who owns an HVAC company, just say, they can go buy another truck. They can hire an additional person, right? And now they can cover more area and generate more revenue for their business, right? Maybe it's a small business and instead of having to send all of their stuff out to the print shop, they can buy a printer in-house. And now they can print internally instead of having to pay these outsourced fees. So you really have to take these dollars and think about how it's being recycled back into the business, right? For them to expand their business and cover some of their costs, but also how it impacts the employees, right? It allows those employees to have this coverage and more benefits so that they can come to work. Because what happens if someone doesn't come to work or if they get hurt? Now you have to have an additional person make up the coverage for that person. So now you have one person doing the job of two people, right? And so it kind of obviously puts pressure on the business. So SMRP is really, really impactful in that way, because it's not just about the business being able to save those $630 per employee annually and the no net cost, right, for them, and then being able to add those added benefits for the employees. But you really have to dive really deep and think about what the employer can do with the money. They also get to go back and offer benefits to the most valuable asset of their business, which is their employees. And then the employees have better coverage, which then makes them increase their work performance because they don't have to worry about some of those things that happened when they were out. So that's how that works, right? Now, what's the other individual in this? Well, it's all of the AYG agents, right? Because they're able to help their communities. They're able to bring this to the forefront for business owners and also these individuals. And then also they're able to start creating the legacy for themselves as well. So it's really a full circle, right, for everything. And also, I just want to add, we are not just a company who just jumped up and decided to do SMRP, right? We didn't do that. We're a full service brokerage. We're licensed in life, health, property, casualty, surety bonds, and claims. And we're, licensed nationally. And so really the reason that we're in all of these spaces is because we want to be able to offer that white glove service to everybody we talk to, whether it's an individual or whether it's a group. And we want them to be able to do it in one spot. You should not have to call one person for your homeowner's insurance, call someone else for your car insurance, someone else for your health insurance, and then someone else for a life insurance policy. And so we really, really are creating how it used to be, where you sit knee to knee with someone, right? I knew my mom and dad's agent. Her name was Debbie at Allstate, and she was amazing, right? But because we're appointed with over 85 different carriers, it allows us to be able to service the person or the business from start to finish. And it's been fantastic. It's been a wild ride. We had some wonderful mentors to help us, get to this part and to this point. And it is definitely our goal to be impactful, right, in our communities, and definitely for women and women of color and men also. Like, why can't we service men too, right? So, and that's another huge thing, right? I have so many kids. I have 5 girls and 5 boys. So I've already tested this theory out on all on men and women. So
no kids were hurt during that exercise, folks.
Yeah.
No kids were hurt.
Well, I don't know. Don't ask that.
Okay, hey, my disclaimer is out there, okay, guys?
Yeah, but absolutely.
Andrea, I mean, this is incredible. First of all, you said over $4 trillion in medical expenses. Is that a year?
Yeah, and that was for the results for 2022. I haven't seen the numbers for 2023, but it's about a 13% increase year over year.
Wow, that is a lot of money. So
it's a lot of money.
This program is going to combat that and hopefully get people healthy so they don't have to go see the doctor and be part of that over $4 trillion in medical expenses. But it's insurance, folks. It's affordable. We have to change our mindset. We have to.
Absolutely.
Andrea mentioned GoFundMe. The churches. I have a pastor. He said he's done. We did a financial literacy webinar for him. It was pre-COVID in person, and he told them, and I was laughing. He's like, we ain't crying no more chicken, no more fish dinners for y'all. Y'all better get this coverage from my man, because we not doing it. But you have to be bold like that, because people expect the 5-star service meals at these services, and I mean, it's ridiculous. It's out of hand. And you guys know what I'm talking about. Don't act like you don't know.
Oh, yes. Yeah, we just did one for my own cousin. So yes, it gets out of hand. We have control of this, and I'm so again overjoyed that the alignment of people that are coming together right now make a difference, like Andrea Millsap-Bolden and AYG Insurance and Financial Services. Remember, my uncle used to sell cars back in the day, and this when I was too small to understand what he's talking about. He used to always talk about, man, I'm sick and tired of these people coming here upside down. And I'm like,
I'm like 5, 6. I'm thinking people
You're like,
are
they're
walking
coming
in
upside
there
down?
upside down. I don't know. So it always stuck with me. And years later, I told them, I said, man, I remember when you first said upside down. I didn't know what you meant. But our society is
Yeah.
like upside down right now.
Right.
So
Right.
AYG is going to be one of the companies that puts people back on their feet.
Yeah. And you
that's
know what else too, Troy? I just want to
Yes.
say, like, there's less than a 2% market penetration with this program, right? And for business owners. And that's really an interesting statistic because it's not a new program. It's just, again, it's one of those things where it's just education, right? And you just don't know what you don't know. So I think that you will start to see, a lot of samur around. And it's just very important to just make sure, because there's bad actors everywhere. It's just very important to make sure that, don't take my word for it. Trust and verify, right? Because it's right until it's wrong. So you got to put good data in to get good data out. But if you're putting bad data in, it's bad data out, right? It's the same thing we've seen, with the ERC and some of these other programs that are there that are actually meant to help you until you take advantage and don't do it correctly, right? So just be mindful of that is all I can say. And the last thing that I'll say is this. If you were so far removed from the pandemic, right? And I had a mentor of mine a long time ago say, you know what, Andrea, do you know what people forget? They forget pain, right? You remember it, but you don't, the actual feeling of the stress that you were in that moment, the further we get away from it, right? You kind of don't, you remember it. It was there. It's like having a baby, right? You remember it, but not really, because you wouldn't do it again if you did. So that is what I'm talking about, right? Now, I'm bringing this up for a specific reason. During the pandemic, guess what was happening? Car insurance was still due. Homeowners insurance was still due. And people, not everybody, but people were still working remotely. Right? So when those people were still working remotely, the benefits were still happening from your business. So insurance is one of those things that, like it, love it, or hate it, it's never going away. It's just not. You have a car, you have car insurance. There's a broker somewhere that wrote that, whether you know it or not, whether you know that broker, and they're being paid. Now, these larger companies, which we love, God bless them, right? That is what makes us different, right? Is because we are the people we serve. We understand. We've been there, we are here, and we are in the communities that we are actually serving to bring that education to, right? And the other businesses, we love them and there's nothing against it, but they've been here for years. I mean, years, like the 1800s, like a very, very long time. Their business is so big and not very change agile, right? Yeah. And so there's a certain population that they serve, and most of it is just, can you pay for it or not?
Yep.
Right? So if you can pay for it, great. And if you can't, well, we're not really going to try to help you find something that you can't afford. It's really simple, right? And that is the main difference for us, right? There's a certain percentage of the population that, if you can afford it, great. And if you can't, we hope you can figure it out. So, and that's not our motto, and that's not what we're doing. So that's my story. That's my story, Troy.
And that's a wonderful story. As my good friend Chris says, it's time for people to stop being a human being and be human. That's right. What AYG is, being human, doing human things, helping people out. Accept your greatness. Andrea Millsap-Bolden, thank you so much for joining the C.A.R.E Global Leadership Series, where we collaborate, accelerate revelation and the elevation. Thank you. God bless you. And let me just tell you like this, and you guys know this. You know me. I love you all, but don't nobody love you more than Troy but God.
I love it.
Take care, everyone. God bless. Take care, Andrea.
Thank you so much.